everyone, it's Jason from BodyWorx Physio, here today to discuss ACL reconstructions, to reconstruct or not to reconstruct. That is the question. We were going to use the skull and do the whole Shakespeare thing, but we're renovating at the moment and the skull got lost somewhere in the clinic. So we'll refilm that maybe later with a bit more drama. So basically ACLs, so anterior cruciate ligaments in your knee when you've ruptured them. Do we reconstruct them or do we hold off and just rehab them? And it's quite topical at the moment because there's two sides to it. Some specialists are saying definitely you want to reconstruct them. Others are saying no, hold off, do the conservative rehab. And we're seeing some Premier League players and some really top athletes getting back to their sport super quickly without that reconstruction. So I thought I'd quickly go through a brief list of what are the fors and against to help you decide or make your decision. Obviously, you're going to talk to your physio, your GP, and your specialist about this because it changes for every single person. So what are the fors to get a reconstruction? So we often look at reconstruction for people that are going to want to change direction in their sport or work life. So if they want to go back to playing soccer or touch or rugby or netball, or if they have a job in an unstable environment, such as like a work site as a carpenter or a builder or something, where they're going to need that stability and changing direction in an unstable environment. The other reasons for it are we do know that if it is not reconstructed and we get increased movement, we're going to see an increase in the development of osteoarthritis in that knee, so an earlier development of that. And the risks with that are, I guess, that if you have increased osteoarthritis, you're more likely to need a knee replacement earlier on in life, which obviously we want to avoid for as long as possible. The other issue is protecting other structures. So if you've just done an ACL rupture and your meniscus and other ligaments are intact and the cartilage is still intact, if you don't get it reconstructed and you twist the knee or do it again, or even just doing multiple little twists, you're more likely to damage the meniscus. And there's a number of studies showing that those who didn't have the surgery originally often end up having a surgery at some point later in the next few years. So one of the reasons to get it reconstructed is try and protect that meniscus, which is a major indicator on whether you need replacement or other surgeries later on after that injury. So what are the againsts about it? Number one, it's the rehab. Anyone who's had an ACL surgery will tell you it's 12 to 18 months realistically of being committed to your physiotherapy rehab. And with that comes the cost of seeing your physiotherapist, making sure you're getting it right, sticking and actually doing the work, because we know the people that don't do their rehab end up with really crappy results. And there's no point going through that surgery if you're not going to commit to the rehab. If you're not going to do it, don't bother, because you'll get a bad result and you can blame the surgeon and the physio all you want. But if you haven't done your homework and committed to your rehab, it's all your fault that your knee is crap and won't move. So that's a big thing with the surgery. Next up is the cost. In Australia, we have an awesome public health system. It will take you maybe 12 to 18 months, 2 years to get into that, get that surgery done sometimes under the public list, because it's counted as elective surgery. So remember that when you're considering whether you need private health or not. If you think that public health covers everything, there's a lot of surgeries that are covered under the elective title. And the fact that your knee doesn't function is still counted as elective under public health. So if you're going through the private system, even with private health, a lot of specialists will have out-of-pocket expenses. So you may still be looking at 2 to 5 or even 7 grand of out-of-pocket expenses, even with private health. The benefit is you'll get to choose the best specialist in town and you'll get it to have it done when you want it to be done. There's risks. So like with any surgery, they're cutting a part of you open. So we have infection risks. There's things like MRSA and golden staph, which can all be affected by that surgery. You also have the risk of clots, and going under general anesthetic is extremely risky still. Thankfully, I say extremely risky. We have a great healthcare system, and our systems in place within both public and private protect you really well. But it is still a risk that you have to consider. Because there is still, and your anaesthetist and specialist will talk to you about all those risks when you talk to them, about what's the risk of infection, what's the risk of it not working. The next risk is re-rupturing, because we also know that even ACL reconstructions have a high re-rupture rate. So you're quite likely, and it depends on your age group and what activities you're doing, affects how many percentage of re-ruptures you get. So please bear that in mind. So that's the fors and against. There's a heap of stuff for to get it done because it does help to protect the knee and make it more stable. But there's also a huge number of issues with getting it redone, and you have to commit to that rehab. If you have any questions about ACLs or rehabilitation, please give us a call on 4952 7033, or you can jump online on the website, send us an email, or book an appointment online. Got a bit tongue-tied at the end there. We've got clinics in Newcastle, Port Stephens and the Hunter Valley. Thanks and have a great day.